My name, my name is Joshua Obaro. I'm a Doctor of Nursing student at Bradman University. I will be presenting a stakeholder plan for implementation of my scholarly project. A stakeholder is an individual involved in the process of a project. A stakeholder is a collective entity such as organizations, initiatives, committees, media outlets, and cultural institutions. A stakeholder involvement and participation in a project tend to generate a better outcome and also a greater sense of ownership. Several organizations use extensive engagement strategies to increase participation and commitment to strategic planning. So there are various ways of engaging the stakeholder. This includes sharing information in a purposeful and consistent way, actively involving stakeholders in the process and educating the stakeholders about the project plan. All key stakeholders need to know is the organization core purpose. Stakeholder engagement helps build ownership within the organization. The objective of the stakeholder educational plan I will discuss will include identification of the key stakeholders, align the stakeholder role in scholarly project, communicate the goal of the scholarly project, discuss the stakeholder educational need, and I also identified a plan for implementing the proposed scholarly project. My clinical question is, in an adult population with hypertension, how does walking 30 minutes daily affect their blood pressure compared to individuals who do not participate in a daily walk in 3 month period? First, I will discuss my project background. Hypertension is one of the leading causes of early death that can be prevented in a society. Over 1 billion people is affected worldwide with hypertension. It produces no symptoms, it causes major effect. It is known as a silent killer. Hypertension is a risk factor for stroke, heart attack, heart failure, renal disease, and premature mortality. Most individuals with hypertension are not even aware of it. So effective weight management is very important. And also integrating 30 minutes of daily physical activities such as walking can decrease high blood pressure. In 2011, the cost of heart disease and stroke was estimated to be 316 billion US dollar. This is including healthcare cost and lost productivity cost. The healthcare cost is proposed to increase to about $818 billion by the year 2030. This is including lost productivity cost. So it is very important that consistent working is very necessary because it has been proved that consistent working can decrease hypertension by 19% to 30%. Many studies have revealed that walking has an impact in the management of hypertension. African Americans are more likely to develop hypertension than the Caucasians and the Spanish. So I will discuss my project goal. My project goal shall include implementation of cultural sensitive based educational program for hypertension, providing a supportive intervention directed towards promoting lifestyle changes, uniform counseling for prevention of hypertension, increasing client adherence to lifestyle adjustment program, teaming up with other members of healthcare teams in the management of hypertension, and also increasing follow-up for hypertensive patients in primary care. So we can achieve this goal by training staff to measure blood pressure accurately, following guidelines set by the GNC for detection, prevention, evaluation, and treatment of high blood pressure. Also by scheduling appointment for all patients that are not achieved goals of high blood pressure goals within 30 days of receiving their blood pressure medication. Also promoting and educating patients about their lifestyle, diet, exercise, and importance of medication compliance. We also will create a registry whereby we'll be able to track hypertensive patients, and also all team members will be trained on the importance of blood pressure goals. So all specialists should be ensured that they intervene for patients that are not in control of their blood pressure. Then I will also discuss the introduction of the stakeholders and their role. The stakeholders include organization leaders, clinic managers, nurse practitioners, patients and their families, medical assistants, physicians, and multidisciplinary team members. The organization leader will approve the implementation of project, provide financial support and support of project goal. They will participate actively and visible throughout the project and build a coalition of support and manage resistance and communicate directly with employee. The clinic manager will involve in staff management, engage in effective communications on how the project can directly impact them and their team. They will be promoting efficiencies and conflict resolution. The clinic manager will also advocate for change in the management. They will assist team members through their own personal transition, interact with the project teams, taking directions and providing feedback. The healthcare providers are other stakeholders. The healthcare providers and stakeholders will obtain informed consent, complying with all the administrative policy procedures, decisions, conditions, and requirements. They will conduct studies in accordance with the relevant current protocols. They will maintain adequate and accurate records in protocols compliance. They will use the clinical trial related communicate, and they will also manage clinical trial patients. They will engage in documentations and also patient recruitment. They will also use ethical issues. Everything should be done professionally. They will ensure ongoing formal and informal communication regarding the clinical trials with team members. The healthcare provider will also support and evaluate patient adherence to the protocols. The medical assistants will be involved in measuring the vital signs such as the height, weight, pulse, body temperatures, and blood pressures. They will collect specimens and they will record this data for the project outcome. Then the patient and the family support system, these are other stakeholders. They will provide constant information for project improvement. They will keep up with the project goals, attend video-based educational programs, and project acceptance. My educational theory for this scholarly project is oral self-care theory. According to the present study, they use nursing consultation. It's a care modality to meet the need of an hypertensive client. The nursing consultation involve lifestyle changes. Through nursing consultation, nurses work to improve patient quality of life. They prepare them for self-care. Oral theory includes self-care theory, self-care deficit theory, and theory of nursing system. The self-care theory refers to self-care, therapeutic requirement, and requirement for self-care. When an individual asks you to develop actions that meet his or her need, he or she is up for self-care. The action needed is to maintain life and promote health and well-being. The nursing process proposed by Oren is used to identify the self-care deficits and role played by the nurses to provide for the requirement necessary for maintenance to meet up the self-care. The objectives of this present study is being established the nursing consultation for hypertensive client using oral self-care theory to guide the nursing process to detect self-care deficit and to stimulate self-care in this client. My educational need will be the organization leaders will be educated on the cost, benefit, importance of the project, and legal implications. They will be encouraged to communicate ideas clearly, powerful and intentionally to inspire and lead others to create vision, shape culture, and shape organizational goals. The healthcare provider will be educated on the review of standard of care for hypertension. They will be motivated and they will use evidence-based practices. Clinic manager will be educated on the use of principles of effective communications. Also, potential barrier of the project will be discussed as well as management of the project. They will be educated on how to build, manage, and lead visual teams while implementing strategies to maximize collaborations and productivities. Patients and family will be educated on complications of disease, importance of diet and exercise. Medical assistants will be educated on proper specimen processing, review of clinical skills and documentation, performing diagnostics and lab tests. My educational intervention. Educational intervention for stakeholders include communicating project with stakeholders, developing an action plan for proposed project. These are setting goals and objectives for the proposed project, identifying and assessing evidence-based intervention that could help address the problem or goal, modifying access, barriers, and opportunities. Then my implementation plan will be include organizing project management, reviewing meetings, review of risk management workshop throughout the whole project management process, organizing a problem-solving workshop, analyzing the problem, brainstorming and possible solution, and having a plan of action. It also includes keeping records of the achieved work progress, since this ensures timely update of our milestones. The video will be used to identify the role of each stakeholders. Implementation plan will include group debates on impact of hypertension, decision making, using assessment to evaluate the project, and finally implementing the changes in accordance to the plan. In conclusion, key stakeholders can have a positive or negative effect on project. They increase the credibility of a proposed project, implement the interventions, advocate for changes, and fund for the project. Stakeholders are expected to support the project they understand. Stakeholder support is very, very important for the successful of implementation of project. Performing a learning need assessment is necessary for project plan. Monitoring project and responses guarantee early identifications of potential barriers. Finally, oral self-care theory apply to hypertensive patients, permit guiding care towards self-care, as well as to organize and apply the nursing process in several phases, such as interview and physical examination, nursing diagnosis, and evaluation. Thank you very much.